My name is Fariz. Now I am in specialty program in internal medicine. At this time, I would like to present risk factors for mortality among patients with diabetic foot infections. Needs the multidisciplinary team of the diabetic foot ulcer and the various risk factors from the recent study. It will complicate treatment and management of diabetic foot infections that cause the mortality. And the objective is to identify the risk factors for mortality in patients with DFI. From the previous study, we highlight they made the scoring system of the mortality between the DFI. Actually, three main pathophysiology is the first one is vasculopathy, and second one is polyneuropathy, and the third one is immunopathy. All of them is caused by prolonged and uncontrolled hyperglycemia. In cross-sectional study, we'll find the relationship between diabetic foot infection through the 18 variables into the mortality. There is a significant relationship between the risk factors for mortality in diabetic foot infection patients. Collected the data from the January until December 2023. The minimum sample size is 180 patients. We also developed a mortality prediction model using a scoring system. 169 survive, 31 patient is mortal. This is the characteristic data. There are 18 variables in mortal patients dominant with the E. coli and Providencias tuarti. We find 5 risk factors that have p-value under 0.05. Continue to the multivariate logistic regression analysis. So the 4 criteria is the first one from the Lehner et al. That surgical intervention was not an independent risk factor for mortality, but the debridement was protective. Novida et al. Study the severity of DFU is positively associated with mortality, but according to Wagner classification, thrombocytopenia, Sen and Dermidal stated that thrombocytosis is an independent risk factor for mortality. Most of the study stated that decline of the EGFR making the increasement of the mortality. We use the formula from the probability using the exponential function from y negative. So this is the simulation of the total score, and all the variables in the study can be measured effectively in every settings of the hospital. Severe infection grade based on the IDSA classification. The second one is without surgical intervention during hospitality. And then the third one is thrombocytopenia. And then the fourth one is reduced EGFR are risk factors for mortality in patients with diabetic foot infection. We also should still always be considered based on the clinical aspects. That's all my presentation today. Thank you very much.